Hi, I'm Atlanta dentist, Dr. Andrew Kokabi of Brookhaven Family Dentistry, and I'm coming to you live from the lovely waiting room of our dental practice here in the Brookhaven suburb of Atlanta. And chances are good that if you are watching this video, then you are having a jaw ache. Your jaw's hurting you. So let's talk it over and see what we can do to make it feel better. First of all, let's discuss the causes of what could have started your jaw ache. Sometimes it can be that you slept on it funny. When you're sleeping, you don't know what you're doing. You can sleep in such a manner that it puts your jaw in an abnormal position and strains it, and this can make it hurt when you wake up. Another thing could be that you bit into something hard. A lot of times a piece of candy or something that you were not anticipating being harder than it is. So bite down, same concept. It kind of gets your jaw out of whack and strains it, and right away you know you've done something that's going to make your jaw hurt. Third one is grinding and clenching. Now, sometimes our patients don't know that they do this. You're sleeping, and in the middle of the night, you're just going to town all night on your teeth. You wake up, and maybe it's not that painful right away, but throughout the day, you start thinking to yourself, my jaw just doesn't feel right. And then finally, we want to make sure that it's not actually a tooth that's causing your pain. We will have situations in which a patient will come and say, well, my tooth is hurting, but also my jaw is hurting. That's probably not your jaw. That's probably your tooth that's causing the main source of the pain, and it's just something called referred pain that's making your jaw hurt. But if you're having pain up here and the teeth feel good, then chances are good that it's your jaw that is hurting you. So now, let's go into some things we can do to make it feel better. Without a doubt, the number one thing I have found my patients tell me brings them relief is a warm compress. You take a hot towel, you put it on your jaw for 15 to 20 minutes, and you can do that 4 to 6 times a day. Just take a washcloth, leave it in some hot water or microwave it, and that makes blood flow back to the jaw and kind of helps it feel better and eases the tension on it. Moist heat, kind of the same concept. You can take a hot shower. That can substitute for one of the times that you're not doing the warm compress. Let that hot water hit the painful area and does the same thing. So this is without a doubt the number one thing you should do. Soft foods, soups, smoothies, milkshakes, mashed potatoes. No gum, jerky, granola bars. You don't want to put too much strain on your jaw. You want to let it heal. You want to take it easy. Eating soft foods allows you to give your jaw a break, whereas eating hard foods just puts more tension on the jaw. So soft foods for sure, for a few days. Some different medications. The best one I have found, my patients tell me brings them the most relief, is over-the-counter ibuprofen, also known as Advil or Motrin. The over-the-counter tablets are usually 200 milligrams, and an adult can take 400 to 600 milligrams every 6 hours. It's an anti-inflammatory, helps make the jaw a little more peaceful and happy, and along with the other things, should help make your jaw feel better. And then another thing is try to keep your jaw closed. You don't want to move your jaw around a lot. Don't open wide. If you have to yawn, it's hard to do, but try to do a controlled yawn. It's the same concept. You don't want to strain your jaw too much. And some people think, well, maybe I should stretch my jaw out. No, you do not want to stretch your jaw out. You want to try to keep it closed as much as possible. And you can tell because when it's open wide, that's when it hurts more. So only make pain-free jaw movements. Don't do this too much. Try to keep your jaw steady. Within 3 to 5 days, you should see a significant improvement in your jaw pain. If you feel it's not getting better, then it may not be a one-time thing that you did to it. Maybe it's a more chronic condition. And in those situations, you should see a doctor that treats the TMJ. TMJ is your temporomandibular joint. It's a fancy term for your jaw. Some different types of healthcare providers that treat jaw aches are, of course, dentists, physical therapists, and oral maxillofacial surgeons. There are different types of treatment. Usually we like to start off with non-invasive treatment options, either some physical therapy or making you a night guard that repositions your jaw and makes it feel better. So, once again, I'm Andrew Kokabi of Brookhaven Family Dentistry. We've got a nice practice here just outside of Atlanta, and in my opinion, it's the greatest dental office in all of Atlanta, the state, the country, possibly the world, but of course I have a biased opinion. But no, we've got a pretty cool office. We've got really kind hygienists and assistants and dentists, and we've got really friendly patients as well. So we're happy to be here, and let us know if we can help you. Thank you. Hey, once again, I'm Brookhaven dentist Andrew Kokabi of Brookhaven Family Dentistry. I hope you enjoyed the video and got some good information out of it. If you did, please do me a favor and press the thumbs up button below and like this video, and maybe even subscribe to the channel. Thanks again.